They also hadn't had tons, they had some healthcare experience, but not in a big system like ours. So we were able to learn together and adapt and grow together. And we took this team and we flew up to Seattle. That was our first thing. So I'm sure a lot of you have gone on site visits and gone to Gemba and all of that. So we did that, and we took this team out, and we went to Children's in Virginia Mesa. We also went to Boeing and saw their moving line. Has anybody in here seen that? The Boeing, just incredible. So we went and saw them, and we developed our master plan for year one. And I don't have a pointer on here, but the woman sitting down, and there's a lot of CEOs around that table, but the woman in the bottom left is Tamara Kaplan. And Tamara is also a pharmacist. That's not a requirement in our health system, by the way, but somehow we have a lot of pharmacists in our health system. And Tamara was in a director role at one of our hospitals, and she stepped up and went, I want to help you with this. So we took her with us, and then she ended up coming over and working for me. And we made a decision to put lean in with performance improvement as opposed to, some standalone within the organization. And what we learned, and I'll just kind of have this come through, is basically as we went out and looked, and the things that you all know, we started to realize, it is about reducing the non-value-added waste. So we'd spent years working on the value-added steps, but this was really about all those things that we've piled on over the last 100 years of healthcare and trying to figure out how to take all those Band-Aids apart, and then what would we do if we were going to build it today? So we learned a lot and thought, that has value for us. And we made this decision. We were so far away from Six Sigma reliability that we just couldn't even think about starting there. So we went down the lean journey. To me, it's sort of a one or the other, 50-50. But I do like the lean language, and it's easier in healthcare, I think, for our practitioners to grasp those concepts specifically. And so this is actually our current house of lean. So, you can go Google that and find the houses of lean out there. We started with our consultant model, and we've evolved it. But the key things here are patients don't wait, so just in time and building those processes. And then on the right, error-proofing healthcare, so we make the errors and problems visible, stop the line, etc. The underpinnings of visual control and value streams, the work in between to level load, get standard work in there, and pull systems. And the house, or the roof of the house, is patients and families first. So I'll just quickly go through this one, but we had a lot of discussion about what to call it. There had been a system like an ops redesign, the latest cost-cutting maneuver across the system about 2 years prior to this called ops redesign. So everybody remembered ops redesign. It wasn't a happy place. And so bringing this in, we had a lot of concern that if we called it lean, people would translate the two and go, oh, that's just the next ops redesign. So as we thought about what to call it, we ended up piggybacking onto something called MC21. And what that stands for is this logo goes through. Basically, we were rolling out our EMR, and in order to do that, our electronic medical record, we had coined the term MemorialCare for the 21st century. So it seemed natural as we studied this more to make this the management system for MC21. MC21 management system is 17 syllables if you actually say it all the way out. And so these days, everybody just says lean. But it was sort of an organic move, and that was kind of nice, that it's the staff and the doctors that moved towards saying lean, and our logo is still MemorialCare for the 21st century, as you can see. So we started thinking about all these wastes out there and what we could do. And we created a roadmap. This is a key point for us, and I think anybody lean is a long-haul journey, as I think we all know. And so we created a 5-year roadmap, and it was interesting. I was looking at the slide last night going, we've pretty much stuck to this. So it's turned out to be good. We didn't want to take on world hunger in year 1, but by year 5, we wanted to be independent, got a whole health system to spread this across and get experience with. So in year 1, we established the foundation. Year 2, we started when we got into value stream work, I'll talk about that, developing a resource office to support all this work, really going deeper in year 3, getting broad value stream improvement, 4, replicating the work and extending it into the supply chain, and then 5, really getting that internal capacity so that by year 5 we could be independent for the most part. We use 5S and RPI, so I've heard those mentioned, or at least RPI this morning. So those were the 2 that we chose to get experience with in year 1. So I'll leave that slide because I know a lot of you are experts in this work. But what we have done with that then is in that first year, we used it to leverage kind of the buzz around the organization. So like many of you, the Friday report outs, getting people there, really, I mean, those were so impressive to me. I remember going and people were crying, every single one, and I cried. It's like, wow, this is so amazing. We're giving people the power and the tools to make a change in things that they haven't been able to change forever. And they come out on a Friday and they've got a plan, and by Monday it's working, that kind of power. We always take tours and show it off. And then one thing I did want to mention that in year one, we realized, even though it was reporting in through performance improvement, we did have a bit of this is the quality work and this is the lean work, and because of the resourcing differences. And so one of the things we actually created was a linkage, a report out of each event or thing we were trialing that then synced back into the quality committee process flow of the organization, so that the quality committee and the medical staff departments, they were all getting a bird's eye view on what lean was doing, even if they hadn't been at the report outs and seen the actual detail. And that helped for the Joint Commission and those kinds of things. So what did we learn in that very first year? We did 17 events. It was very foundational. We actually exceeded it was going to cost us $2 million. We knew we weren't going to get that all back the first year. We said, well, let's just try and get 700,000. We got close to $1 million of demonstrated benefit through supply chain reduction,